Yeah, my name's Steve Morris. I'm CEO of NPS MedicineWise.
Fantastic, thank you. Now we've had a full day of presentations here. What are the takeaway messages for you?
I think there are many kind of learnings from today's conference, but I think some key takeaways are it's all about the narrative, it's about the story that we provide to both clinicians and consumers, about the ethos of choosing wisely. It's about remembering that in the end we're dealing with human interaction in how we spread these messages, and it's really around advocacy at all levels, whether it's between clinicians, consumers, and supporting positive change in the sphere of choosing wisely. And that choosing wisely really is not a series of separate projects or implementations, it's an ethos, and the view should be to really embed that ethos across all decision making within the health system.
Was there anything you were really struck by in terms of the barriers that people are facing? Was there a unifying group of
No,
them?
I think the barriers most people came up were the same, that you will always get a group that may be defensive, may be resistant, and there are some perceptions around medical legal issues which came up several times. They are just perceptions probably rather than being reality. But what struck me was that if you have perseverance and you innovate and you continue to pursue those good messages, then you can deliver really good outcomes.
And your big focus today was on scale and sustainability. Do you feel any closer to a solution on that?
Look, I think obviously the first big scale project, at least from a hospital health system perspective, has been pursued in Victoria, and I think they put forward some really good learning points around the things you do and don't do in terms of trying to have successful scale implementation. And ultimately, going back to what I said previously, it's about how it becomes an ethos and a way of thinking that gets sustained beyond a particular intervention and particular project.
Now, what does Choosing Wisely now do with that Victorian initiative, that state level?
So part of NPS MedicineWise Rolling, I suppose, leading the initiative within Australia, is to take those learnings and share them as widely as we can, both in terms of the resources that other organisations have produced, and we announced the launch of a couple of resources today which we'll share, but also it's about connecting people. And part of today, the over 230 delegates that are here today will have made, I'm sure, individual connections, about those personal connections, about learning, the conversations that occur that help really spread and inculcate good practice in the Australian environment.
In terms though of what Victoria has done, do you have a hope that within the next couple of years you're going to see that happening in all the other states and territories?
I think some early conversations we're aware of in some other states is starting to reflect on the sorts of things that have been done in Victoria. Every system is different in the Australian environment from a jurisdiction basis. The issues are the same. So it's just about how you contextualise some of the ways of working in the Victorian environment and work how they would work within different jurisdictions. Because it's not just to kind of lift what Victoria have done exactly and put it into another state, but some of the principles, processes and methodology would be exactly the same.
Ahead of the conference, you said that you've had really good buy-in from hospitals to date, and now the next focus really is going to be on GPs, primary care. What were some takeaways today from that?
Yeah, again, I think it's about some of the same methodologies that have been applied in the acute sector you can apply in the primary care sector. The system is different and the levers are slightly different, but some of the principles are the same. It's about convincing, persuading consumers and practitioners to no longer continue to accept low value care or care without evidence, and how we, particularly in the primary care sector, provide confidence to consumers to ask those 5 critical questions about healthcare, and from a system perspective engage with PHNs in terms of their role around clinical improvement and system change within the primary care sphere.
There's a little concern mentioned about lack of consumer on one of the panel discussions today. What's is that something you'll take on board, and have you got bigger
I think
plans?
that was probably just a misconception about that session. I think overall, I think as the same person identified, is that we probably had more consumers at this conference than we had in any other previous Choosing Wisely conference. And the joint resources we produced with Consumer Health Forum, as an organisation, NPS MedicineWise as a facilitator of Choosing Wisely firmly believes in co-design. And Choosing Wisely can only really be delivered if we empower consumers to ask those questions.
What about targets? Like, what are you looking to do? Have you got a 12-month, 2-year target?
No, I suppose there isn't. In many terms, the initiative is really in its early stages in Australia. We only started in 2015. I think we've gained significant momentum. The 30 champion health services that exist have demonstrated locally, as Victoria have done, about reduction in the utilisation of some of those low-value initiatives and those without evidence. And as time progresses, we'll be looking to how you accumulate that data to really demonstrate an impact in terms of positive consumer outcomes.
And one of the other topics that came up with us at Croakey, it came up at another health conference recently, was about the carbon footprint of the health services, and Peter Sainsbury at that conference said that choosing wisely was a really excellent initiative for being able to reduce that. Do you think, is that something that the carbon footprint of healthcare, is that something that could be on the agenda for choosing wisely?
I think it fits with the ethos of choosing wisely, which is really about reducing waste in the system. By waste, it means inappropriate tests, procedures and interventions. And if we can reduce those, then undoubtedly the consequence of that will be to reduce the carbon footprint of those initiatives.
Is it something, though, that you think is more incidental than would drive?
I think the premise of choosing wisely is about high quality care, and reduction in waste is a consequence of following high quality care principles empowered by consumers. So I think in that respect it would seem to me to be a consequence of that, a positive consequence.
Fantastic. Now, if people are interested, especially people working in the health sector, what do you advise them to do?
If you're interested, we have a dedicated website. Just type in Choosing Wisely into Google, you'll come across our website. A whole stack of resources, both produced by my own organisation, NPS MedicineWise, but also practices, initiatives shared by all our partners and members. And within that, we have a team of people at NPS MedicineWise who'll be more than happy to answer your specific queries, and we're more than happy to come out into your health system and really talk about the real benefit that Choosing Wisely can deliver.
Fantastic, Steve.
Okay,
thank you very much.